Biden administration has declared the monkeypox outbreak a national health emergency, sounding the alarm over the growing number of cases across the U.S. Joining us now, Dr. Scott Gottlieb, former FDA commissioner and a CNBC contributor. He also serves on the boards of Pfizer and Illumina. And getting to this point, Doctor, it sounds bad. It is bad. But do we need to temper our pessimism? Because we've just been through something that obviously with COVID, was that a whole different situation that we saw than what we're seeing now? We need to be aware of this, but I don't think we're going to shut down schools anytime soon, are we?
Well, that's certainly true. This represents a whole different level of risk. I think that this is more akin to what we faced with Zika, where you have the potential for a slow-moving infection that becomes endemic. It becomes a fact of life, and you get a new infection that you have to worry about, but it's going to be a low-level infection. This is not going to be a raging epidemic like you saw with COVID, certainly. I think the risk right now is that this starts to get a foothold here in the United States, if it hasn't already. It's spreading right now as a sexually transmitted disease, but it's not a sexually transmitted disease, so it's going to start to spread outside those social networks. And you just see this as a low-level threat. And going forward, when doctors see patients presenting with unusual cases of what they presume to be shingles or they presume to be herpes, they're now going to have to start testing for monkeypox as well. But you're right, this isn't going to spread widely and rapidly. But the risk is that this becomes just another pathogen that we need to deal with. And that's unfortunate. It didn't need to be that way. If we had acted aggressively early, we could have potentially snuffed this out.
So a pathogen, but there's been the mortality is what? The mortality is zero, or is it, what is it?
Yeah, look, in West Africa, where this has predominantly spread previously, the mortality was 3 to 4%, but the strain that spread in that region was presumed to be more virulent. Right now, we haven't seen any deaths. We have seen hospitalizations as a consequence of people getting sick with the virus, but we have not seen any deaths. So hopefully it remains that way. But this still is a pathogen, at least here in the United States, we haven't seen deaths, but this still is a pathogen that in an immunocompromised individual, in a young child, in a pregnant woman can be dangerous. And so this represents a certain amount of risk. It's certainly not on the order of what we see from other viruses and certainly not similar to its close cousin smallpox. But it's still risky to people who are vulnerable to it. Well,
close cousin of smallpox, that sort of leads me to the next question. And the chances that some type of evolution of this thing into either something more infectious or more virulent, is there enough spread right now to where there's an incubation of enough of these enough virus where that could actually happen?
Yeah, look, we've seen it already evolve. Like I said, it has evolved in the direction of becoming less virulent from the clade that was spreading in West Africa. It's a DNA virus. It replicates through DNA, so it's more stable, certainly, than the viruses that replicate through RNA like COVID or influenza. But it does have the potential to evolve over time in certain directions. Right now, it has evolved in the direction of being less serious. It could evolve backwards back into the direction of being a more serious infection. But so far, the cases we've seen here, a lot of them have been milder, and that's why it's been hard to diagnose this, because people aren't presenting with the typical disseminated rash that you've seen historically. They're presenting with isolated lesions that are becoming confused for zoster infections, shingles, or herpes. I personally know a number of physicians who've diagnosed patients with shingles who didn't presume to have any risk factors for monkeypox. They didn't resolve with conventional treatment for herpes, for zoster. And then they represented, got tested, and turned out to have monkeypox. I think that's partly why we've seen cases go up rapidly, is because a lot of those were either backlogs, people who couldn't get tested because testing wasn't available, or people who are getting tested now for monkeypox because doctors are now starting to suspect that infection. So I think case growth is probably going to slow here in the United States.